Potentially some big news for travelers out of Queen's Park here today. The Ford government is proposing ending out-of-country OHIP coverage. As it stands right now, OHIP will cover up to $400 Canadian per day for inpatient hospital visits in the United States and up to $50 per day for outpatient care. But again, the Ford government considering putting an end to that as of October 1st.
It's not very effective insurance for people who are traveling. It covers, I think, often about 5 cents of every dollar. And so it may give people the illusion that they have coverage that they find they don't have. We just don't think it's a very effective use of our health dollars. We're looking at every program. We want to make sure that we get the most value for every health dollar we spend.
The big problem the NDP's Merritt Stiles had with this is how it came to light today. It was posted on a ministry website with no fanfare.
We're seeing a pattern here. This is about a pattern, whether it's public health, ambulance services, and the privatization of health care. These decisions are being made behind closed doors in the stealth at night, without any conversation with Ontarians.
Why not be more upfront about this?
Well, I think that is being upfront. We've posted it. We haven't made any decision yet.
Is it really?
It's
if the media didn't find out about it?
We didn't find it. Nobody would know about it.
It's a proposal, simply, and we're discussing it with people.
So what do you need to know for your trip next year if this goes through? We talked to a travel insurance lawyer. How really big of a deal is this? Are a lot of people using OHIP when they travel?
They do. Just keep in mind that the government is taking away the $400, up to $400, but they're not tightening up the insurance regulations. They're not telling insurance companies that they can't deny claims as frequently as they do. So people are going to have no coverage from OHIP, and at the same time, they're going to be denied by their own travel insurance companies.
So this is affecting mostly who? The elderly or who?
I think the elderly, for the most part, they're the ones who end up utilizing it, from my experience. Usually for illnesses, usually for injuries that happen when they travel, and they usually travel for a few months in many instances, right, for the winter season.
A lot of people think I booked the trip with my credit card, that'll cover me.
You have to be careful. Again, you're going to have exclusions. And remember, the insurance you have through credit cards, they're going to have not only exclusions, they're going to have limitations in terms of how much you can cover. So if one insurance policy tells you that you can cover up to $500 a day, another one will tell you it's up to $200 a day. Every policy is different.
The Ford government allowing 6 days for consultations on this proposal. In the legislature, Richard Southern, City News.